I'm presenting the updated results of the COSMIC-313 study. It's a study for patients with first-line advanced metastatic clear cell renal cancer. It's for patients with intermediate and porous disease where Ipi/Nivo is a standard of care. And this is the first trial to test the triplet of Cabozantinib, which is a VEGF TKI, with Ipi/Nivo versus Ipi/Nivo alone. So a classic randomized phase 3 study. But the thing that's different about it is the first time we've got an immune doublet as the control arm. Now you'll be aware that it was presented at ESMO by Tony Chueri beautifully, and he showed a positive PFS signal. He showed a positive trial therefore, and what we have done here is shown the updated PFS signal, and we focused particularly in this presentation on the differences between the intermediate and the poor risk patients. I think it's worthwhile saying at this point that we haven't yet seen an overall survival signal, therefore this data hasn't yet changed practice, but we hope it will in the future with that survival signal. I think it's also fair to say the response rates were not as high as some people were looking for, and that's something which we are looking into, the reasons for that. And some people said, is it because there's more toxicity with the triplet compared to the doublet? And I think there's some evidence that that's the case. Therefore that survival signal is going to turn out to be very important. The presentation which I'm giving shows updated data with 5 additional months of follow-up, but you'll also be aware that the original data set had 550 patients in it. That was the PITT population, the progression-free ITT population. We've now got the 850 patients. And the terrific news is the PFS hazard ratio remains at 0.74, which is great, very consistent, a tighter hazard ratio with tighter confidence intervals with longer follow-up, showing a consistent PFS signal. So there probably increases the chance of it translating into an OS signal, in my opinion. That's number one. And then number two is in that ITT population, the 850 patient with the longer follow-up, that difference between the intermediate and the poor risk is still there. So the PFS signal in the poorest population is about 0.93 and 0.68 in the intermediate risk patients. And so it looks like the triplet is benefiting the intermediate patients more than the poorest patients. So we then looked, because we assumed maybe it was because there was more toxicity in those poorest patients, maybe worse performance status, less tolerability, maybe we were unable to get the drugs in. And we didn't show that. Actually what we showed, it was equally easy to deliver drugs to the intermediate and the poorest population. The toxicity in the two groups were about the same. And so if that's not the case, what other explanations might there be? And the obvious explanation is the biology between the two groups different, and that's worthwhile thinking about. There is some data which shows the poorest group's disease is driven somewhat independently of VEGF, and therefore Cabozantinib as a VEGF inhibitor might not be making much difference in that group. And that's quite interesting because I think many people historically have looked at those really poor risk patients and said we have to get control with VEGF targeted therapy. So it might lead to change the way we think about the disease a little bit. So I think that's exciting. And then the other piece which I think we need to always consider is it's an exploratory analysis, and it's not got alpha spend associated with it, and therefore there's noise. The subgroup, the poorest subgroup, is a relatively modest size, about 100 patients in each arm, and therefore, this might be there for luck alone. So we need to be a bit careful before we overinterpret this. What I think it does do is it points to further biomarker developments in the future, which is relevant. And there are other triplet trials that are ongoing, and we need to be mindful of these IMDC classifications as we watch these trials read out.